My name is Eduardo Perez. I am an associate professor in the Ingram School of Engineering at Texas State University. And the title for this presentation is a location model to improve access to healthy food markets. This work was done in collaboration with Jose Pagan, Dr. Pagan, from the Health Policy and Management School at the New York University. The agenda for this presentation includes the motivation and background for the problem statement, which includes the objective and the literature review, the methodology, which involves data analysis and the development of a decision-making optimization model, a computational study, and the conclusions. The motivation for this research is that their low-income households in rural areas lack access to vendors that sell high-quality and nutritious healthy foods. The lack of access makes it difficult for residents to maintain healthy diets. And these people that have lack of access typically have higher risk of suffering from chronic illnesses, such as diabetes, cardiovascular diseases, and strokes. So the goal of this research is to improve the access to nutritious and healthy foods in rural communities. In terms of the background, health policy decision makers are aware of the needs for coordinated multi-sectoral preventive action to promote the health of patients. There are multiple initiatives such national and recent residential and national initiative in the US are trying to identify and intervene in the so-called food deserts. These are areas, particularly lower income neighborhoods with limited access to affordable and nutritious food. In small towns and rural areas, food deserts have been defined as areas more than 10 miles from a supermarket. The residential food environment is the availability of food outlets near where the person lives. And again, there are multiple definitions in terms of distance, and those are shown in this slide. Anything from 0.25 miles up to 2 miles, or approximately 5 to 30 minutes of walking is what is considered your residential food environment. Urban planners use 0.5 miles as buffer, and 1 mile has been recommended by the US Surgeon General. So the problem statement, we need new decision-making models to improve the food access in food deserts. These models are needed to inform public health professionals to decide where should new investments be directed to achieve their greatest community health impact. So in this figure, I'm showing the general problem. In the bottom left side of the figure, the different neighborhoods in the city are represented. Each neighborhood is described by the number of residents, their expected monthly demand for produce, and their distance from the neighborhood to the existing supermarket, and also fast food restaurants. The bottom right side of the figure shows the options available in terms of available facilities in the city to open new markets, new produce markets. Each available location option is described in terms of population coverage. L stands for low, M stands for medium, and H stands for high. Monthly cost of operating the facility, and store size and capacity of serving customers on a monthly basis. Each option offers different levels of service according to this combination of factors. The top box of the figure represents the decision-making portion of the problem that should decide location or locations to fund given a limited budget and neighborhood needs. In this work, a decision-making model that can help address these issues is developed. So the research objective for this research is to develop optimization models to determine the number of and location of product markets needed to improve access of healthy food in rural communities. In terms of the literature review, there are similar applications in terms of policy-related interventions food donation, excess crops, and supermarket location type of problems. But none of these research have looked at the problem from the point of view that I just defined. Um, so on the next slide, I'm going to show you the methodology and the solution approach. And you can see from this figure that this is an integrated um, framework in which we are collaborating, or the methodology is collaborating with an agent-based simulation model that is going to track the status of the participants or the citizens of the community in terms of their health conditions and how they change according to the access they have to food or healthy options in terms of food. So the outputs from the agent-based simulation model, the outputs will be the patient outcomes based on their access to food markets, are used as an input parameter to the decision-making model that seeks to find optimal location for new product markets offering high quality and nutritious healthy foods. The citizens data, funding data, new produce market distances to participants or citizens, and new produce market cost data are also used as inputs for the decision-making model. The following, so we are going to describe the population data analysis that we perform in terms of our methodology. So this research study considers a rural city in Northwest Texas. The land area for the town is 3.43 square miles. And the population per square mile is about 1,503 citizens as reported by the census in 2010. The percentage of people with ages 18 to 65 is 54.7%, where 50% of the population are females. Only 8% of the population has a bachelor's degree or higher, and 66% graduated from high school. The food environment characteristics for this city is they have access to 9 fast food restaurants, and they only have access to 1 supermarket offering fruit and produce. So based on our problem, we developed some interventions factors to consider in our study. 3 possible intervention factors are considered in this research study. The first one is recommended driving distance to the nearest produce market. The second one is the expected capacity of the existing and new produce markets. And the third one is the amount of funds available to open new stores or new produce markets. The recommended driving distance to the nearest produce stores identifies the number of existing and new stores candidates that are located within a specified distance. Like if we are looking at 1 mile, we want to use that amount, that distance to determine how many stores are within 1 mile from the location of this community. As documented in previous studies, the majority of rural residents drive to food outlets. Only 4% of residents walk to grocery stores, compared with 20% of residents in urban areas. While rural residents generally have higher vehicle ownership, those who lack reliable access to personal vehicles are particularly isolated given the longer distance to stores and the lack of public transportation options. The expected capacity of existing and new produce stores consider the number of people that the store can serve, and is based on the store produce availability. The amount of funds available to open new produce stores studies the impact of funding availability. Funding sources include foundations, private and government. These 3 factors were studied at different levels to understand their impact on 3 performance measurements: the percentage of population with access to produce, the recommended number and location of new produce stores, and the ratio of fast food outlets to produce markets for the area. In terms of the simulation model, we have access to an agent-based simulation developed by Kataporis. And this model predicts the individual dietary behaviors in a rural community located in West Texas. The agent-based model simulated the impact of increasing product access on fruit and vegetable consumption. And they found that decreasing the driver distance to product outlets would increase the fruit and vegetable consumption in the community. So for example, a 1 mile decrease in driver distance to the nearest produce stores could lead to an 8.9 increase in fruit and vegetable consumption. And a 5 mile decrease in driver distance could lead to a 25% increase in fruit and vegetable consumption in the community. However, they don't propose, they have these results, but there's no way for them to propose policies on where to locate these new stores given these results. So that's why we extended, or we provided a model, and we defined this model, this optimization model, to make those decisions based on the feedback provided by the agent-based simulation. So in this table, we defined the sets, the decision variables, and the parameters for the model. The decision variables are mostly binary variables, and they decide whether you locate a store in a specific location, available location, or you don't. And then we have a decision variable that determines how many communities are covered by and have access to the fruit and vegetable stores. The optimization model is shown in this slide. We have the IP model changes according to the experimental questions to be answered. So, but there are constraints that are shown in this model are always present. So equation 2 determines if the neighborhood is within a distance of the existing produce market or a proposed new market. Equation 3 studies the impact of reducing concentrations of fast food outlets within a specified distance. And the objective function is trying to maximize the population coverage. This model that we are presenting in this slide was used to answer this first question: what is the impact of considering different radius distances to define the residential food environment when selecting the optimal locations for new produce markets? And then we added some extra constraints to answer 2 additional questions. So the other question is, what is the impact of considering different service capacity levels for produce markets when selecting the optimal location for new produce markets? And what are the implications of different funding levels when selecting the optimal location for new produce markets? The experimental design considered 3 levels for each one of the factors considered in this study. And figure number 4 shows the location and of the neighborhoods in the rural town considered in this study. So here's some of the results. So what is the impact of considering different radius distances to define the residential food environment when selecting optimal locations for new produce markets? What we found, and what this figure is showing, is that the percentage of population with access to produce, number of new produce stores, and ratio of fast foods to produce markets when considering different radius distance. For this part of the experiment, produce market monthly service capacity and funding availability were set at their highest level. So the maximum percentage of population coverage when residential food environment is defined by a 1 mile radius was 69.1%, and this was achieved by opening 1 new produce market. The maximum percentage of population coverage when residential food environment is defined by 2.5 miles radius was 100%, and this was achieved by opening 3 new produce markets. Now, in terms of, let's look at the last questions. What are the implications of different funding levels when selecting the optimal locations? So the maximum population coverage when the monthly funding availability is set to low is 100%, and this is achieved by opening 2 new produce markets with high monthly capacity. The maximum number of percentage of population coverage when the monthly funding availability is set to normal is also 100%, and this is achieved by opening 2 new produce markets at high serving capacity. And finally, the maximum percentage coverage when the monthly funding availability is set to normal is 100%, and this is achieved by opening 2 new produce markets at high serving capacity. So in terms of this work, Lack of access makes it difficult for residents to maintain healthy diets, higher risk of suffering from chronic illness like diabetes, cardiovascular disease, and stroke. So in this work, we developed an optimization model to determine the number of allocation of product markers needed to improve access of healthy food in rural communities. And using this decision-making model, we show the effects of varying 3 different intervention factors on 3 different intervention outcomes related to improving products accessibility. So here's my information, and thank you for your time.